Living with cancer. The conventional medicine has concentrated on cell biology for the study of the cancer. Very less effort has been taken to identify the causes of the cancer and guide the society or particular cancer patient for its avoidance. According to Ayurveda, treatment in short is avoidance of causes. For any science, this is the most scientific approach because the cause-effect relationship is the base of any science. Unfortunately, this base has been kept aside by conventional medicine, and as a principle, only destruction of the cancer cells through surgery, chemotherapy or radiation is emphasized in all stages of all varieties of cancers. No doubt, this destruction of the cell principle has very limited success in local and primary stage of the cancer. But in advanced cases, this has very less success of remission for a while. Furthermore, that leads to aggravation of the disease due to reduced immunity. The chemotherapy or radiation is hazardous for normal cells as well. As a consequence, the destruction of normal cells leads to loss of immunity, leading further to aggravation of the disease, demanding cycles of chemo or radiation, and a vicious circle is set. More the advanced disease, more advanced chemo and more damage to the body is created due to the loss of immunity. The aggravated disease keeps on demanding advanced chemotherapy again and again. So, chemotherapy or radiation becomes the cause of the recurrence of the disease repeatedly. Finally, the vicious circle leads to such a miserable stage in which nothing can be offered by conventional medicine. The patient has to die miserably. Can't we avoid this? We have to see the merits and demerits or benefits and losses of every treatment, and only if the merit or benefit of treatment supersedes demerit or losses for a particular patient and in a particular stage, then only the treatment can be thought of him or her. Otherwise, it is better to refrain from such treatments. The next question that immediately arises is about what to do with the pain or other troublesome symptoms of the disease, which are not manageable without chemotherapy or radiation. Because we are observing the things on the basis of fixed idea like the particular viewpoint of destruction of abnormal cells, it makes us difficult to observe the things with a different angle. If chemotherapy or radiotherapy is not appropriate in that particular patient and in the particular stage, we have to think of some alternatives to revert the situation. Here, once again, the principle of the avoidance of causes plays an important role, and let us understand this with an example. Consider that we are driving a car at the pace of 60 miles per kilometer and now we want to stop the car. The first step is required to take off the feet from the accelerator so that we stop the aggravating factor. Then we have to change the gear from top to low and finally to apply the brake to stop the vehicle. So the role of the brake comes at the end. Avoidance of the causative factors is the need of the hour. For that, one should start to identify the causes. Then only we can think of avoiding them. This principle of avoidance of the causes is not only beneficial for the patient but also for the society, as this prohibits the victimization of everyone worldwide. The global society is thus benefited. Tobacco, either in chewable form or by smoking, is known as the cause of cancer worldwide. Still, very few efforts have been taken to get rid of addiction, especially in the young generations. What to talk about other causes, especially junk foods and foods hazard to health, and that is also not avoided. The psychological aspects like stress, fear and depression do aggravate or create the disease, but nobody gives any guidance about their avoidance or the ways to combat them. Heredity also plays big role in cancer patients. Urbanization and pollution also contribute to worsen the situation. But we are coming across even infants or very old people in the age group of 80 to 90 and suffering from advanced cancer. They never have any addiction, didn't take any junk foods and fast foods, and don't have the heredity of the cancer. However, cancer is rapidly spreading across the globe. So, what could be the reason? Since the whole global society is at stake, the reason should be very common in all communities. The root is in the farming. Especially during last 4-5 decades, drastic changes were adopted in the farming. The traditional farming has been abolished due to the modern technology. Particularly the hybridization process in the crops and animals has led to unnatural mutations that gives rise to conversion of normal cell into abnormal one, which is termed as cancer. The farmers have lost their seed banks and they have become dependent on the producing companies of the seeds. Moreover, these plants don't possess good immunity. How can we derive immunity from them? Due to less immunity, these plants become susceptible to various infections. So, the chemical pesticides were introduced as prophylaxis to combat the infectious diseases, and these pesticides are poisonous. Now with their use, the water, the soil or the crops all have become toxic for us. The problem is aggravated by the use of chemical fertilizers and preservative techniques. Moreover, these have destroyed even the natural enemies which can control these harmful creatures or microorganisms. Thus, we are trapped in a vicious circle of this new farming technology. Somehow, we have to restore the natural seed banks and start natural organic farming once again. Then only the reversal is possible. Even in the animal farming, the hybridization has led to especially HF cow termed as A1. Now people are realizing the hazardous effect of milk and milk products of this A1 cow. One may read Devil in the Milk to get more clarity of the subject. We have to put effort to go back to A2 type of cow milk once again. Fortunately, the Indian Desi cows have great potential to restore the situation. The corporate sector has entered into the food industry and the food has been industrialized and commercialized due to mass production. They can keep prices low and capture the market effectively. As a result, small farmers doing traditional farming find it quite difficult even to survive. Moreover, the ecological balance between plants and animals has been lost and use of animals in the farming has significantly reduced. This is leading to a scarcity of natural fertilization like cow dung and cow urine, etc. We need to concentrate on natural animal farming once again to revert to the cycle. If this is the root of cancer, then the whole society should turn towards organic or natural foods. Though it is costly at the moment and the availability is also less, those who can afford easily should start purchasing it. As a result, the demand will increase, so also the flow. Then the prices also will come down, making it affordable even for a common man. So, though it is bit costly right now, we have to invest in it for our own benefit and spread the message in the society to save the nature. In nutshell, the avoidance of the causes in the form of today's hazardous food and switching over to natural food is the first step in the reversal of the disease. Like in the previous example of the car, to take off the feet from the accelerator, this is the step towards controlling the disease by stopping of aggravation. Now the second step would be to get back to natural Ayurvedic lifestyle, like emphasizing on getting up in the morning, going to the bed early, having light dinner preferably before sunset, doing regular exercises and yoga practice and positive attitude. This is like switching to a lower gear in the example. Now the third step is medication. If we have scope for purification process in the form of panchakarma, do undergo them under the supervision of an Ayurvedic expert and follow that by rejuvenation treatment under the guidance of experienced Ayurvedic physician. This is the same step as applying the brake for the actual stop of the vehicle in the example. So, chemotherapy and radiation are not at all choices for the treatment in advanced stages. This avoidance of them results in positive changes in the lifestyle and the commencement of the Ayurvedic treatment, which can bring miraculous results. But it's an expert's job and not every Vaidya will be able to do it. So the concept, if we do not kill cancer, the cancer will kill us, is itself a misconception or misbelief. One can live with cancer normally for many years. It's like diabetes, hypertension and heart disease, etc. Patient can live along with medication, yoga practices and lifestyle corrections in these diseases. This is even true for cancer patients. One has to follow the path and experience it without fear, happily. Once you start consuming and digesting at least 1.5 liters of desi cow milk, you can very well sustain with relief in symptoms. That's my experience for last 32 years. So make a bold decision of not getting trapped in the vicious circle of recurrence of disease and live with cancer a normal life.